Let's see an NCLEX RN video based on care for patients with biliary and pancreatic dysfunction. The nurse assesses for which clinical manifestation in the patient with cholecystitis. Murphy sign, Trousseau sign, Cullen sign, Gray-Turner sign. A positive Cullen sign is bruising around the periumbilical area and may indicate pancreatitis. Gray-Turner sign occurs in flank and may indicate pancreatitis. Murphy sign is a test conducted to determine disease of the gallbladder, and Trousseau sign indicates hypocalcemia. So here the clinical manifestation in the patient with cholecystitis can be assessed with Murphy sign. Which intervention should the nurse provide to a patient with a T-tube? Routinely flush with preservative saline solution, routinely monitor drainage output, provide T-tube maintenance teaching to the patient, monitor stool for color and consistency, clamp the T-tube when the patient is sleeping. T-tube should be flushed with preservative-free saline solution, not solution with preservatives. Patients should be educated on monitoring the drainage, maintenance of the tube, and monitoring the stool for color and consistency. The T-tube should not be clamped as it allows drainage. So here, routinely monitor the drainage output, provide T-tube maintenance teaching to the patient, monitor stool for color and consistency. The nurse admitting a patient with acute pancreatitis correlates this disease process with which etiology? Inflammation secondary to toxic substances, abuse of alcohol, destruction of the pancreas by viruses, digestion of the pancreas by enzymes. Acute pancreatitis is caused by the autodigestion of the pancreas by the pancreatic enzymes it produces. Which type of shock is exhibited in a patient with pancreatitis? Cardiogenic shock, hypovolemic shock, septic shock, hemorrhagic shock. The type of shock most commonly exhibited by a patient with pancreatitis is hypovolemic shock due to capillary leak and third space losses. Cardiogenic shock refers to the inability of the heart to pump blood to the body. Septic shock refers to the inflammatory response associated with infection, and hemorrhagic shock refers to shock associated with blood loss. What is the leading cause of pancreatic cancer? Low-fat diet, smoking, history of cancer, heart disease. The exact cause of pancreatic cancer is not known, but there is a high association with behaviors such as cigarette smoking, diets high in fat, and refined sugars. The nurse recognizes which is a risk factor for cholecystitis. Obesity, male, female, African American descent, European descent. Cholecystitis is the inflammation of the gallbladder due to the obstruction of the bile flow. Risk factors for cholecystitis include obesity and more common in women and also the people of European descent. The nurse correlates which clinical manifestation to cholecystitis? Retroperitoneal pain, absence of bowel sounds, diarrhea, RUQ pain, that is right upper quadrant pain. A classic symptom of a patient with cholecystitis is the pain in the right upper quadrant. So RUQ pain will be there in cholecystitis. It is due to the inflammation of the gallbladder. Absence of bowel sounds, diarrhea and retroperitoneal pain can be attributed to any other medical condition. The most specific laboratory result in the patient with acute pancreatitis is an elevation in which laboratory value? serum bilirubin, serum lipase, serum trypsin, and serum lactase. Laboratory tests used in the diagnosis of pancreatitis include a metabolic panel, hematology studies, and specific tests of pancreatic enzymes such as serum amylase and serum lipase. Elevated serum lipase is the most specific test for pancreatitis since lipase is produced only by the pancreas. The nurse receives the patient from the operating room after he undergoes a Whipple procedure. The nurse recognizes that this procedure is indicated for the patient who has which disorder? Acute pancreatitis, peritonitis, cholecystitis, pancreatic cancer. The surgical procedure for a patient with pancreatic cancer is known as Whipple procedure. The nurse assesses for which finding in a patient with a positive colon sign: periumbilical bruising, rebound tenderness, right upper quadrant pain with radiation to shoulder, flank bruising. A positive colon sign is bruising around the periumbilical area. Rebound tenderness can occur during a clinical exam of the abdomen when the provider pushes firmly on the abdomen, and upon release the patient develops pain in the abdomen. Right upper quadrant pain with radiation to the shoulder indicates cholecystitis, and flank bruising refers to Gray-Turner sign. The nurse should question the administration of which medication in the patient admitted with cholecystitis: acetaminophen, Demerol, ibuprofen, morphine. Pain medication for a patient with cholecystitis include acetaminophen, ibuprofen, and meperidine. Morphine is contraindicated because it causes spasm in the sphincter of Oddi, which exacerbates the pain. So nurse should question administration of morphine. So patient Tony presents to the emergency department with severe acute epigastric pain, nausea and vomiting. He describes the pain as sudden and radiating to the back. His heart rate is 110 beats per minute, BP 108 by 65 mmHg, respiratory rate 18, temperature 100.2 degree Fahrenheit. His abdomen is tender. Laboratory values include WBC 10.7 into 10 raised to 3 mmQ, blood urea nitrogen 23 mg per dl, creatinine 1.2 mg per dl, serum lipase level 250 unit per liter, amylase 3500 units per liter, alanine transaminase ALT is 190 units per liter, aspartate aminotransferase AST is 150 units per liter, total bilirubin is 0.4 mg per dl, and albumin 3.3 gram per dl. His sclera are slightly yellow. Tony has been in the hospital for 1 day and was transferred to the medical ICU morning for worsening symptoms. On physical examination, he is restless and slightly combative. His BP is 9143 mmHg and his heart rate is 100 beats per minute. He is short of breath with a respiratory rate of 24. His oxygen saturation is 85% on room air. Temperature is 101.3. His abdomen is distended and he has severe pain. He screams that the staffs are trying to kill him by keeping him in the hospital, and all he wants to do is to go back to his friend's house and continue to party. He states that he drinks a ton of beer whenever he feels like it and occasionally uses marijuana. His arms and legs are covered with tattoos and some scarring from his former IV drug use. His pupils are reactive and equal, and his sclera are slightly yellow, as is his skin. He states that his urine looks like really dark iced tea. Tony is diagnosed with acute pancreatitis secondary to his alcoholic binge over the weekend. Tony's condition continues to worsen. His abdominal pain is excruciating. He is delirious and he develops hypovolemic shock with a BP of 80-40 mmHg, heart rate of 125 beats per minute. Because of hypovolemic shock, fluid resuscitation is started in an attempt to increase his BP. Diagnostic test revealed chest X-ray indicating left pleural effusions at atelectasis. ECG revealing sinus tachycardia, elevated serum lipase and amylase. Tony is intubated and placed on a mechanical ventilator and started on broad-spectrum antibiotics for treatment of acute pancreatitis and hypovolemic shock. He is closely monitored for necrotizing pancreatitis and sepsis. Tony's pain continues to worsen. What is irrational for the healthcare provider to more likely prescribe meperidine or demerol for pain instead of morphine? Meperidine can be given IV or IM. Morphine is not absorbed in the pancreas. Morphine causes spasm in the sphincter of Oddi. Meperidine is better tolerated in patients with substance abuse. Morphine is contraindicated as a pain medication for pancreatitis because it causes spasm of the sphincter of Oddi, which will lead to pain. What laboratory finding is the primary diagnostic indicator for pancreatitis? Elevated blood urea nitrogen, elevated serum lipase, elevated AST, elevated lactate dehydrogenase. Blood urea nitrogen is a measurement of kidney function. AST, LDH are measurements of liver function, and elevated serum lipase is specific to pancreatitis as lipase is produced by the pancreas. In reviewing the prescriptions for Tony's acute pancreatitis, what order would the nurse anticipate? Maintain NPO status, oral fluid resuscitation, low-fat diet, regular diet. Patients with acute pancreatitis are kept in nil per oral status to prevent the release of pancreatic enzymes that break down fats, proteins and carbohydrates. During the physical examination of Tony, what clinical manifestation correlates with his diagnosis? Constipation, stertorrhea, clear lung sound all throughout all lung fields and diarrhea. Stertorrhea is a passage of pale, clay-colored, greasy, bulky stool. Patients have these colorless stools due to the obstruction of bile flow. Tony is ready for discharge. What should be included in his discharge teaching about pancreatitis? Education about alcohol restriction, education about smoking cessation, education about a low carbohydrate diet, education about vaccines. There are multiple causes of pancreatitis, but the most frequent causes are gallstones, alcohol consumption, and the presence of gallstones and trauma. Alcohol consumption accounts for approximately 1/3 of all cases and is frequently found in men. So, the nurse should educate about alcohol restriction. Hope you understood this video. Thank you so much. Keep watching.